So I went into orthopedic surgery because a lot of the things that I like to do in my life are being active, whether it was playing sports growing up or now being pretty active in outdoor activities. And a lot of the patients that I see in clinic are trying to do those same things. So it's very easy for me to engage with them and understand their goals and try to find a way that as a physician, I can help them reach those goals. And the field I'm going into is hip and knee replacement, and certainly those are surgeries and treatments that get people back doing those things that I like to do as well. Yeah, so a typical visit for me, a patient comes in, they've usually had several years of hip or knee pain. We get a set of x-rays to look to see, if there's arthritis in the hip or the knee. We'll review x-rays, we'll talk about treatment options. With arthritis, there's always a period of time where we try conservative treatment, whether it be with some medications, some occasional injections. Once those are no longer working, and after a lot of discussion with the patient, the next step would then be to talk about a surgery, whether it be a hip or a knee replacement. So any visit could talk about any spectrum of those treatments. So I think the most rewarding thing is kind of circling back to why I went into orthopedics. A lot of the patients, when they see me, are not able to do the hobbies or the activities, or something as simple as going to get their groceries without having pain in their hip and their knee. In the surgery and the treatment for arthritis with the hip or a knee replacement, the goal is to get them back doing those things. And sometimes as early as a month after surgery for hip replacement, a little longer for knee, when they come back to see me in clinic and say, hey, I'm back doing the things I wasn't before, that's certainly the most rewarding part of it. I think extraordinary care to me is an understanding that a patient has chosen to trust you with a very, very large part of their life. Surgeries are a very big deal, and if a patient has agreed to have you be their physician and be their caring surgeon, it is a tremendous amount of trust that they have in you, and knowing that everything you're going to do for that patient is going to be in their best interest, and making sure that you do everything possible to give them the best outcome. I think that's probably the best example of extraordinary care. My wife and I actually both grew up here in Ames, so it's been a really good full circle coming back to Ames, being able to be in the community that I grew up in, that kind of supported me throughout all of elementary school, middle school, high school. Now being back here and trying to help the people that helped me growing up is going to be a really exciting part of starting this next chapter for us.